Hi there. You're being shown this video because you have started down the pathway toward shoulder surgery with the Minneapolis VA Orthopedics Department. My name is Brittany Betcher, and I'm a nurse surgical coordinator for orthopedics. In this video, I will walk you through all the steps in the pre-surgery, surgery, and post-surgery process. After I speak to you, the physical therapy department will walk you through some of the important do's and don'ts after surgery. They will teach you which exercises you are allowed to do in the first 2 weeks after surgery, depending on what you're having done. Let's start by talking about the pre-surgery process. Before surgery, you will have an appointment with a medical doctor at the VA's medicine clinic or with your primary care provider to make sure you're medically cleared and physically ready for surgery. At this appointment, you should discuss medication management for surgery. Some medications need to be stopped prior to surgery, so pay particular attention to what your provider instructs you to do. Before surgery, you may also get blood work, an EKG, or imaging done, such as an X-ray, MRI, or CT scan. Please reach out to your surgical coordinators if you have any questions about your pre-surgery visits. You will also have an orthopedic pre-surgery appointment. In fact, this is where you are now. Today, we'll review the plan for surgery and sign a consent form. If indicated, we will fit you for a shoulder sling, also called a shoulder immobilizer. If you receive one today, you must bring it with you on the day of surgery. Before you leave the clinic today, you will schedule your post-surgery appointments. To do so, stop at the front desk to make your first 2 follow-up appointments. Your first appointment is a nurse follow-up, where your incision will be checked. Your second follow-up will be with your surgeon, which typically occurs 6 to 8 weeks after surgery. You will also have, or may have already had, a pre-operative anesthesia appointment. This may be done in person or over the phone. It is a great time to learn and ask questions about what type of anesthesia you will receive during surgery. In most cases, a nerve block is used for pain control. If you are being admitted for surgery, you will have, or may have already had, a pre-admissions appointment located near the main doors. Location is 1S128. The purpose of this appointment is to confirm eligibility as well as review contact information in your chart. This appointment may also be completed over the phone. Lastly, before you leave the building today, make sure you stop by the outpatient pharmacy to pick up a medication called benzoyl peroxide. This medication is used to reduce the amount of P. acne bacteria that lives on your skin because it can cause an infection. It is an ointment that comes in a tube. Here are the instructions for use. 2 days before your surgery, you will apply some of the ointment to your entire shoulder and under the armpit, once in the morning and once again in the evening. The day before your surgery, you will repeat these same steps, except make sure to do the evening application after your 2 surgical scrubs have been completed. The morning of your surgery, make sure to apply the ointment one last time before heading to the hospital for surgery. This may not apply to you, but if you are having a total shoulder replacement, you will also pick up an additional medication called mupirocin. This medication reduces the amount of bacteria, called MRSA, that may be colonized in your nose. You will apply this medication to the inside of your nose twice a day, starting 5 days prior to surgery. Your last application of the medication will be done the evening before surgery. Make sure you attend all pre-surgery appointments that have been scheduled for you, and again, stop by the pharmacy to pick up your ointment before you leave the hospital today.
My name is Emily Grimshaw, and I am a nurse coordinator for the orthopedic surgery department. I'm going to go over some reminders for you starting 1 week before your surgery. 7 days prior to your surgery. 1 week before your surgery, you should sit down and review your specific medication instructions. If you have any questions about when to stop taking any of the medications, please call your surgery coordinator. 5 days prior to surgery. For those of you that are having a total shoulder replacement, this is when you will start applying the mupirocin to your nose twice a day. Remember, your last application of this medication will be the evening prior to your surgery. These instructions are written in your surgery packet on page 2. 2 days prior to surgery. This is when you need to start applying your benzoyl peroxide ointment to the entire operative shoulder and under your armpit. You do this twice a day, in the morning and again in the evening. Please note that this medication may bleach fabric it touches, such as a shirt or bed sheet, so you may want to wear an older shirt that can be stained and consider changing your sheets or laying on a towel. The day prior to surgery. The evening before surgery, you'll perform your 2 surgical scrubs in the shower. The instructions for how to use these scrubs are located in your instruction packet on page 3. After your 2 showers with the surgical scrubs, you will apply the benzoyl peroxide ointment to the surgical shoulder and under the armpit prior to going to bed. Do not have anything to eat 8 hours prior to your surgery check-in time. You can only drink clear liquids up to 2 hours prior to your surgery check-in time. For example, if your check-in time is 6 a.m., your last time to drink would be 4 a.m. Some examples of clear liquid are water, coffee no cream, sports drinks such as Gatorade, and clear juice such as apple juice. Please do not add anything to your coffee like honey or cream. The day of surgery. Continue to follow any medication instructions that were given to you. Apply your last application of benzoyl peroxide to the shoulder before heading to the hospital. If you were given a shoulder sling or a mobilizer, please bring this with you the day of surgery. Also, bring your blue education folder with you. If you are having a same-day surgery, meaning you will go home the same day, you will check into the surgery center on 2T. Your driver must check in with you and stay in the hospital during your surgery. If you are being admitted to the hospital for surgery, meaning you will stay overnight, you will also check into the surgery center on 2T. If you have any questions about where and how you should check in, refer to your appointment letter or to page 1 of your surgery packet. For those of you that are being admitted to the hospital for surgery, be prepared to spend 1 to 2 nights in the hospital. Please leave all your medications at home because they will be provided for you. You will work with physical therapy and occupational therapy prior to being discharged home. If you use a CPAP at home and are being admitted, please let your nurse coordinator know and bring your machine with you the day of surgery.
What to expect after surgery. Next, I'll talk about what to expect after surgery. You can refer to your education folder for any details specific to you. Post-surgery questions or concerns. Please call the VA call center with questions after surgery. If it is a medical emergency, please call 911 or seek care in the emergency room. Pain control. It is important to control your pain. Remember, however, that the goal is not to completely eliminate the pain, but to control it. We utilize many options, such as different types of pain medications, ice, and proper positioning of the shoulder immobilizer. If you are allowed to take acetaminophen or NSAIDs, such as ibuprofen, please start taking these medications before your block wears off. If you are given a polar ice machine, it is to be used continuously for the first 48 to 72 hours after surgery. Please use it as much as possible after this, including hooking it up prior to going to bed. Wound care. Every surgery site is closed differently. Sometimes glue, sutures, steri-strips, or Perino tape-like dressing will be used. Shoulder surgery incisions closed with sutures. For those of you who have had an arthroscopy, also referred to as a scope, or any surgery where the incisions are closed with sutures, the incisions will either be closed with a dissolvable sutures or non-dissolvable sutures. Dissolvable sutures are clear, and you may see a clear tie on the outside of the skin. They do not need to be removed and are sometimes covered with steri-strips. Non-dissolvable sutures do need to be removed and are usually black or blue in color. These get removed at your 2-week nurse follow-up. If your incisions were closed in one of the above ways, the bulky dressing placed on your shoulder should be removed 2 days after surgery. Regardless of suture type, after the bulky dressing is removed, you can shower. After removal, you can let water run over the incision sites in the shower. Just do not scrub them, pat the area dry. You can leave the sites open to air. You do not need to put any dressings on it. Just think clean and dry. Shoulder surgery incisions closed with Perino dressing. For those of you that have had a surgical site closed with Perino dressing, which is a mesh superglue-like dressing, know that is waterproof and sealed. You do not need to cover the incision or Perino dressing with anything. If there is a gauze dressing on top of it when you arrive home, you may remove it. Just be careful not to take off the Perino with it. Perino looks like a thin piece of mesh tape. You are allowed to shower the same day or day after surgery. You can let water run over the incision in the shower. Just do not scrub it, pat the area dry when done. Do not pick at it, peel it back, or put any lotions on top of the Perino dressing. Take a hands-off approach. It will fall off on its own in about 3 to 4 weeks, and the incision beneath it should be closed at that point. Follow-up appointments. Outpatient physical therapy will start 2 weeks after surgery. 2 weeks after surgery, you will also have a post-operative nurse visit, at which time an RN will assess your incision and, if ready, remove any sutures in place. This follow-up will either be at Minneapolis VA Orthopedics Clinic or set up at your primary care clinic. You will also follow up again around 6 to 8 weeks after surgery at the Minneapolis VA Orthopedic Clinic. You will meet with a resident surgeon to assess your recovery process. If you had a total shoulder replacement, you'll get a set of x-rays before your visit to verify placement. This is all from nursing. Please review this video as many times as you need to using the QR code inside of your blue education folder. Next, the physical therapy department is going to cover the do's and don'ts after surgery, as well as some exercises you can do depending on what you've had done.
Hi, my name is Susan McKenna, Doctorate of Physical Therapy and Certified Orthopedic Manual Therapist. I'm an orthopedic outpatient physical therapist for the Minneapolis VA Medical Center. I'm going to walk you through the sling immobilizer, pointers after surgery, as well as exercises that you are able to do after surgery. Please remember, shoulder surgery is a bit different, so it's important that you reference your written surgery education materials to know which specific restrictions you will have based on the procedure that you and your surgeon have agreed on. Don and doff the shoulder immobilizer. Please reference your specific shoulder surgery instructions in your education folder to review these instructions as well as see images of each of these steps. Do's and don't with your shoulder immobilizer. If you were fitted for a shoulder immobilizer, please follow these do's and don'ts to allow the proper healing of the shoulder. Do wear your sling with abduction pillow all times except when allowed to come out for personal hygiene, dressing, or physical therapy approved exercises. Do position the shoulder in the sling so the shoulder is slightly in front and to the side. Your hand may or may not be in the center of your body. Do keep your operative arm level or at a slight up angle to prevent the arm from falling forward and out of the sling. This will allow the arm to be more comfortable and supported correctly. Do ice as instructed using your Polar Ice machine provided. Do wear your sling and support your arm for sleeping. Oftentimes, patients need to sleep in a recliner or in an upright position in bed until you are allowed to come out of the sling. Do expect the sling to be uncomfortable at times. The sling is serving a very important purpose. Please discuss any concerns with your sling with your physical therapist to improve the fit and positioning. If needed, don't remove the sling and go without it, even if it feels better. The sling is there to support and allow the shoulder to heal. Don't actively use the operative arm, even if it doesn't hurt or feels good to do so, until instructed. Passive range of motion of the shoulder. Active elbow range of motion. Movement restrictions. Please follow the provided instructions for movement restrictions after surgery. If you have questions, please call the center or ask your physical therapist. We want to avoid any damage after surgery. This includes limiting any strenuous activities with the non-operative arm as well. Motions such as cutting wood, shoveling snow, bowling with the non-operative arm can put a strain on the shoulder you had surgery on. Special note: after surgery, your surgical team and the nursing staff should review what occurred during the surgery and if restrictions changed from the pre-surgery plan. If you have any questions, please ask or call the clinic. Prior to discharge from either this surgery center or inpatient unit, you should know: how long do I need to wear the sling for? What motions am I allowed to do on the operated side? When do I start PT?